Hello. So it's been 21 days since the first day that my husband was diagnosed with a glioma. So in this video, I'm going to talk about how it all started. It wasn't easy for us at all. It had been just 21 days, but we felt like eternity, felt like forever. Because you seriously, right now, you don't know what to do. All you can do is to wait for the operation and for the biopsy to know what is going on in his head. So every time when we went to a hospital or an I said that because we didn't do only one MRI, we didn't visit only one doctor, we did a lot. Just to have a impression on his head, just to confirm what we need to do. So every time when we saw a doctor or went to a hospital, the doctor, the nurse, or the MRI technicians would ask us one question: what brought us there? Like, what brings you here today? And the answer to that question is always nothing. Why? Because he didn't have any symptoms to go there to do an MRI for his head. So we discovered this brain tumor by accident. Let me go back to travel back in time to the day. So in early December, my husband has a chronic sinusitis. He always have kind of like runny nose, and he has to take medicine for his nose. And every time when the weather changes or if the air is too polluted, we are living in Hanoi, and in Hanoi it is very populated, so it's very normal when for us to visit the hospital when he has problem with his nose. And then it's become a chronic sinusitis, and it's been like that for like more than a decade now. And last time in early December, he had the same thing, of course, and he visited the hospital and took a bunch of pills, including the antibiotics. But then last time the antibiotic didn't really work well on him. And he still has has a lot of mucus inside his sinus and run down to his throat, which caused a lot of coughing. And that's why he went back to the hospital to check his nose again, and to check if he need to change the medicines. So when he visited the hospital as a follow-up appointment, the doctor advised him that he need to do an MRI of his nose over here to see the inside of his nose. And when they did an MRI of his nose, they noticed a mass in his brain. So there you go. It started there, and it was all by accident that they saw a mass in his head. And then he was transferred to the neurology for an appointment and for another MRI of his head. So back then, he did another MRI of his head, and they saw a mass. And at first, the doctor didn't think, he suspected it is a tumor, but at the same time, he just said that it is a brain lesion, and it could relate it to my pregnancy and the postpartum depression or something. I'm not sure if it is postpartum depression or something, but it is like the parental thing. When the doctor said that because I have just gave birth for only 1 month back then, and we had a baby crying, and the doctor said that maybe he has a brain lesion over here, and it was also common with the father when they have a newborn, if they have to deal with a lot of stress and lack of sleep and also lack of sex. And it was because like apparently with my birth or the delivery and the recovery from delivery, we didn't have a lot of sex back then, and the doctor said that it could be because of that. So it was very difficult for the father, so there could be a link between the situation and the brain lesion. So, and he was totally healthy back then, and the only problem he has is with his nose, like sneezing, runny nose, and coughing because of the mucus, nothing else. So then the doctor say that he can go home safely and go back to hospital again for another MRI of the head, with this time with the contrast agent, to discover the lesion, the mass that they found in his brain. And because of that, he was very confident going home, thinking that everything is just all right. And when the date of the MRI came, we even skipped it. We called the hospital to cancel the appointment because we was late for, I remember that we woke up late and we don't think that we can make it in time for the appointment, so we canceled the appointment and told the hospital that we will call to book another one soon. And back then, both my husband and I was like perfectly normal. We just think like, because the doctor was not concerned about our case, and it doesn't look like anything that is so dangerous, and most of it was that my husband was very healthy. He speaks normally, he walks normally. There's nothing abnormal about his case. So then on the day when we booked another appointment to go back to the hospital, we did another MRI with the contrast agent, and in the MRI they discovered that that was a tumor, a brain tumor. And from the neurology, they had an impression that he has a low-grade glioma, which is a kind of brain tumor, or could be grade 1 or grade 2, could even be benign, we don't know. And then they advised us to see an oncology, to go to oncology and to be transferred to a different hospital. So the reason was that the hospital we visited at first was Vinmec Hospital, which is an international hospital in Vietnam, in Hanoi right now, and then it is a good hospital, but they don't have a neurosurgeon. They just have a neurology department and oncology department. They don't have the neurosurgeon with the knowledge to open your brain. So that is why they advise us to go to a different hospital, which is a level 1 hospital in Vietnam, specialized about brain tumor and all kind of tumor in your body. But that one is the top 1 hospital to go in Vietnam when you have the situation like my husband. So before we were transferred there, the Vinmec Hospital contacted the expert from the other hospital to invite an expert to review our case. And at first he said that it could be he concluded that he advised that we need to do a surgery. Could be an awake brain surgery, or could be a sleeping surgery. And we was a bit freaked out back then, because doing the awake surgery could be scary, like it sounds like a scary concept. But the more we study about it, the more we understand that doing an awake surgery could benefit the patient, because when it would allow the surgeon to take more of the bad part of your brain out without damaging your function, because they can check your function in real life. So it was just like all the suggestion after the review between both hospitals back then, right? So then we was advised to contact that expert directly, and lucky for us, that expert in the other hospital was one of the top neurosurgeons in not only Vietnam but also in the region, around here, in the region of a few countries around here. So I feel safe that my husband is in the right hand. And yeah, and then after that we were trying to book an appointment with the expert, that doctor, that neurosurgeon from the other hospital. And it was like it was at the same time, it was a big holiday in Vietnam, the New Year's Eve. You guys know, or you guys knows, you know it is the festive, the holiday season. So we had to wait for a long time. For us it was a long time, but it was actually a few days before he replied to us. But then for us it felt like a long time, because of course you have a condition, you don't know what it is, and you freak out all the time. You need someone to talk to for a consultation and to know what to do. And that's why we had an appointment with him after the holiday, and he advised us that we can do a surgery, a sleeping surgery. Let me show you the brain on his tumor. I have it here. I'm sorry, I said the wrong thing. I mean the tumor in his brain. Let me turn the camera around.